I got into healthcare because it was calling me. I always wanted to work with people. I'm compassionate and I love feeling like maybe that I'm needed, that I can make a difference. Feel like if somebody's at a vulnerable time, I can be there for them. I remember after I entered the healthcare field, all these special moments where I felt like I made a difference.
In my job on an oncology floor, we work interdisciplinary with a lot of different people, so it requires working with physiotherapists, doctors, to ensure that the patient has the proper care that they need to cure their illness and maybe be able to go home.
As a massage therapist, usually you want to improve somebody's well-being as a whole. We are dealing with soft tissue injuries or just muscle soreness in general. So we're just trying to better people's activities of daily living or make it easier for them to do those activities of daily living and to make them feel good.
Ultrasound is just a form of diagnostic imaging. It's where we use sound waves to take images of patients' internal organs, blood vessels, muscles, and obviously assess fetuses for pregnant women. So a typical day at work is really scanning from patient to patient, doing various exams from an abdomen, pelvises, obstetrics exam. We certainly assist in special procedures as well, so biopsies and things like that, but it's really just scanning patient to patient every day.
My typical day consists of waking up in the morning, heading to the gym first thing, and then I make my way to work. As soon as I get to work, I get my assignment for the day and I start researching the client's doctor's orders, vital signs. We listen to a report and then we come out a report and we prioritize what we need to do first.
So my typical work day usually starts around 7:30. I usually get up with my daughter, get her ready. I get ready for my first patient who usually comes around 9. I usually treat about 4 patients a day. That will consist of the treatment. Usually it's an hour treatment. And then I will do their invoice and payment. And then I'll write a report on that massage therapy treatment.
I'm very much a people person. I'm sociable and I like caring for patients, so that's a big key to my job. I get to work individually with patients one-on-one while I'm performing the scan, but I involve patients' families, other healthcare professionals when needed. Everybody's around and we work as a big team if we need to. So a hobby I enjoy is certainly doing exercise. I really enjoy running and doing weights. That helps keep me fit and in a great state of mind for my job. Work can be very physical sometimes, so it helps if I stay fit, prevent potential injuries that could happen. It also is a great stress reliever at the end of the day if it's a particularly stressful day.
Being able to communicate with many different interdisciplinary people that work in healthcare is the exact same as it is in soccer, I find, because myself, I was a captain for many years, and to have that leadership role is very important because you have to be a team player and offer constructive criticism.
I think massage therapy really fits in well with my lifestyle. Like, it was almost chosen for me. I found out within 2 months of taking my massage therapy course that I was losing my sight. So right now, after 13 years, I have maybe 3% of my vision left. And massage therapy gives me my independence. It provides me my income so I can support my family. And it gives me a great deal of personal satisfaction to know that I can help people. And I think I'm more in tune with my tactile abilities because I'm vision impaired. So it betters my career as well.
I certainly see our profession moving forward. There are so many opportunities for our LPNs. We have LPNs working in long-term care, hospital sectors. We have them working in community, corrections. We have them working in physician offices, and we're also seeing many LPNs starting to engage in becoming entrepreneurs. With our aging population, we have several LPNs opening special care homes.
As a massage therapist also working from home, my family life is improved because I can set my own hours. Before I had my daughter, I was working late nights, well, late enough, working until 9 o'clock at night. And since I had my daughter, I can set my schedule to work from 5 to 6 and have the chance to spend a lot more time with her.
So in 10 years, I'd like to still be scanning an ultrasound in New Brunswick. I'd certainly love to maybe have taken a few extra courses in ultrasound for certain specialty scans, as well as continue advancement in ever-changing technology in this field.
Being a massage therapist, you have to really consider the fact that it can be hard on the body. So it's not always a career that's long-lasting if you don't take care of yourself. You have to make sure that you're not working too much, that you're wearing yourself out, because you can cause injury to yourself. So for me, working with just 4 patients a day, I find that's a great balance. And I think I can maintain that for probably 10 to 20 years to come.
In 10 years, I'd still love and be honored to work as a licensed practical nurse, especially to stay in New Brunswick. I feel like I have family in New Brunswick, and to be able to give back to my community as a licensed practical nurse, I feel like that's where my goal is in 10 years' time.
For me, I love New Brunswick. My family's here, my support is here. I love the people here. I find that it's clean and the people are friendly, and I wouldn't even think about going anywhere else.
I chose to stay and work in New Brunswick because I grew up here. A lot of my family's still here, my friends are here, so I like being close to home. It's a beautiful province with lots of outdoor activities to do. There's also conveniently a low cost of living and a lot less traffic than larger cities.
Last week, I sent a reminder of somebody's treatment through email, and they said, "You don't need to send me a reminder. I'm counting down the days or the minutes." And I said, "Oh, that makes me feel so good to know that people are looking forward to their next appointment." When you see them come in and they're walking all crooked, and they come out and you're seeing them walk to their car and you see them walking more straight than when they first came in, that's personal satisfaction for me.
I love my role in healthcare. I love that I get to help find the cause of people's pain or illnesses or swelling, whatever it may be, and I get to care for them before, during, or after the exam. I help ease their worries if they have any. But a super fun part of my job certainly is when you get to show parents their babies. So I scan the babies for an hour, pretty much to measure a whole bunch of things and look at multiple organs. So when I finally get to show them and then you see how excited they are to see their baby for the first time, it's pretty special.
What I find most satisfying about my job is to be able to go home at the end of the day, every day, and feel like I made a difference in someone's life, whether it be having a chat with them, doing something for them, interacting with families. That's the most satisfying, being able to go home at the end of the day and feeling like I made a difference.